talking about breast cancer. We have joining us this morning Dr. Jozelle Miller, health psychologist, and Dr. Erica Jordan, a general surgeon. And we touched on the physical side, what we should be looking out for as men and women. And I know when we talk about breast cancer, people automatically think and they go to those two. What should I say? Lump, not lumps. What should I say? Breast, your breast. But it actually extends to your armpits. And Dr. Jordan mentioned earlier that many people actually miss that and they only examine the breast tissue, but they should be examining going straight around to your armpits for any lumps or masses. She touched on secretions as well, what is normal from what is not normal. Some of the risk factors, she spoke about your health, the wellness, and the well being, exercising, your diet, all of those things that might increase your chances or increase your risk factors for actually being diagnosed or getting breast cancer. All right. So before we take calls and questions, let us talk about the emotional side of breast cancer. So you're diagnosed, and this part here, Dr. Miller will take care of that one. So you're diagnosed with breast cancer, right? What should a person do, or normally, what are the first sort of chain of thoughts that would run through a person's mind when the doctor says to them, "I'm very sorry to tell you, but you have breast cancer. You've been diagnosed with breast cancer."
Okay, hi everyone, good morning again. So I'm here this morning as health psychologist, yes, but also as the president and founder of the Scotch Cancer Support Foundation. And it is one of the mandates we have as a foundation to provide psychological and emotional support to persons diagnosed with cancer, and not just breast cancer, but any cancer here in St. Vincent and the Grenadines. Now, when a patient is diagnosed with cancer, breast cancer, any cancer, literally in that moment, I believe all patients they shut down. That they are probably not going to be hearing what comes next after, I'm sorry to say, because right away a fear takes over, and this is generally what we hear from patients when we would have sessions with them, that I am totally fearful. I do not know what to expect. They're at a position where they start thinking that it is all over for me, that regardless to what you try, that it is not going to help. And this is one of the things that we want to try and change, to get persons to understand that early detection, if perchance you have a diagnosis in stage one, stage two, you have a fighting chance to actually turn things around. Now, typically, we see the fear. Some persons become very angry, and a lot of it is that the person is also going through the grief stages. You know, we have the denial, persons go into anger, persons start bargaining even and say, God, if you take this from me, I'm going to do better, I'm going to do X, Y, Z, yada, yada. Then we have the depression comes in, where persons sometimes literally shut down. And the depression is the part that we are very concerned about, because if the person has not yet mobilized themselves to get help, this is where communication is cut. And one of the things that we want to change, and our theme this year as we look at breast cancer, is unmasking cancer, meaning that we want persons to understand it is not something to hide. I think too many of our patients have been, dealing with it on their own, hiding. They don't want family or friends to know, because I believe they feel some level of judgment is coming their way, or they feel embarrassed, because your breast is part of your sexual representation as a female, as your identity. So when persons start thinking that, okay, I'm going to lose my breast, you start having this sort of disconnect, that I am no longer this person. I'm going to change. So people keep quiet, they withdraw themselves, they withdraw communication, and because of that, you do not get the necessary help in the time frame that is going to make a difference. And with cancer, time is critical. It is not something that you can just easily think, well, okay, I'll deal with this next year. I'll deal with this next month. Even sometimes dealing with this next week could be too late. So we want persons to understand the urgency. There's a lot of anxiety, and the anxiety is about the unknown. I don't know what is going to happen. And sometimes, as good as our physicians are, they can't answer all the questions either. So there's always going to be this question mark, this space that even amidst the chemotherapy, the radiotherapy, and all of these things, there's a possibility, there's a percentage that says this may not work. And I think it's that unknown space that a lot of persons tend to dwell in. One of the other concerns that persons have is that what is going to happen when I do chemotherapy? I'm going to lose my hair. This is something else I'm going to lose. I'm going to lose my breasts, I'm going to lose my hair, and I'm not going to be the same person. And I remember some years ago, um, to commemorate Breast Cancer Month, I did a story or an article in the newspaper, I Am Not My Hair, where I wanted to let persons understand that whilst you are connected to certain things as your identifier, we have to
Mhm.
look at the bigger picture, and the bigger picture is preservation of life. So even amidst losing certain things, we are fighting for something bigger. Okay, and that is the train of thought that we have to try and let a person diagnosed with cancer that they have to take that approach.
Okay. In terms of, so based on your findings, or based on your interaction with persons who are diagnosed with breast cancer, um, do you think it is easier for them to speak about it after, for those who would have been reluctant to talk? Do you think that they become more open once they pass the stage of recovery, once those patients would have had successful treatments? Do they open up a little bit more after that?
Yes, I think in the initial stages, persons want to keep it close. And I mean, we could understand why. It's something that you as an individual have to process. But what I caution about is that for as it relates to any diagnosis, any illness, support is very important. So I understand persons want to deal with it privately, but there's a difference between being private and being secret. Okay, and privacy means that there are certain persons, your physician, your family, trust that you can let in, that can offer that support and guidance that you need. Now, when persons have gone through the stages in terms of they have been diagnosed, have started treatment, and now at a point where they are, there's some regression and they are functioning well, persons are better able to share their testimony, and they share it from the standpoint of encouraging others to say, I've been there and this is where I'm at now. I'm not fully out of the woods, but I'm in a better place. So
Hmm.
yes, I think it's easier for persons to share after the fact as opposed to in the immediate stages.
Okay. I what is going through my mind right now is that it very well might be that it's a cycle in terms of, okay, so women out here who are looking on and listening on, they're noticing that not a lot of women are speaking about their experience while they're going through treatment, or finding out or having to deal with breast cancer. So could that lend itself to some women being so reserved, or trying to, or not wanting to share that information with other people because people aren't
Yeah.
speaking about it? Yeah.
Well, yes, but I understand why some persons may be hesitant because the truth is we are living in a very harsh society where
Mm-hmm.
persons can take something as sensitive as someone's diagnosis of cancer and turn it into a millipot, turn it into something negative, turn it into something that casts judgment, and persons do not need that added stress.
Mm-hmm.
They do not need that added pressure now of persons asking questions. And a lot of times Persons ask questions for the sake of getting information, but not showing that they actually care. So I understand all of that. And that is why I would say when we talk about unmasking cancer, we want persons to understand that they are going to be persons who can support them along their journey. Not everybody. I don't want it to be that persons take away that Dr. Miller is saying you need to go and shout it on the mountaintop. But I want you to have persons within your space that can offer comfort. And Dr. Jordan is here. One of the things that most of the doctors will say when you're coming to see the surgeon, coming to see the doctor, bring a family member. Because again, when certain things are being discussed and your anxiety step in, your fear steps in, your brain literally shuts off.
Right.
So a lot of the details are going to be missed. When you have a family member there or somebody that you trust to support you, they're going to be able to ask some of the fundamental questions. They're going to be able to talk on your behalf in areas where you have already shut down.
In terms of dealing with breast cancer, your advice for men who might have wives or significant others, sisters, aunts, mothers who are experiencing this right now, your advice for men.
Yeah. So the thing is, the conversation must involve them. If you are married, you're in a um, stable relationship, that conversation as it relates to your breast cancer must also involve them because obviously your breast is part of your sexuality. And a lot of men have their own concerns as well. One of the things that I will say is that even as you go through the process, sometimes persons begin to tiptoe around you and they are afraid to talk about certain topics that they think might be too difficult or they feel that it's going to cause the person to shut down. I would say, based on your relationship, if it is that you always had an open relationship, talk about it upfront. Let your fears be known, both sides. Let him say exactly how he feels about this particular issue. And you, as a patient, you also need to share what is it you need because oftentimes people can jump into this mode of helping, and the patient themselves feels like it's too much so that no longer are you being asked what you want. Everybody's telling you, and your dignity as a human being is taken away from you. Your right, your ability to actually speak for yourself, sometimes that disappears. So you have to tell persons what you need. Be
Okay.
upfront and say, okay, I need this much and no more right now.
Okay. All right. So you have to step away in about 2 minutes or so, right?
Yes.
Right, right, right. So we have to wrap up in about 2 minutes. All right. Unfortunately, because there's so many things that we could discuss concerning breast cancer. In terms of
We can
treatment.
come back.
Right. So right. But before you go, right, a question for Dr. Jordan coming from a listener. Crystal, my daughter had a lump in her breast the size of a red plum. She took it out, but more start coming back. What can she do?
Now, how old is the daughter? Do you know?
It wasn't stated here, but
Okay.
I will
In
ask.
adolescence, there is something, a benign breast disease that is called a fibroadenoma. It is a fibrous tissue lump that appears in the breast.
Mm-hmm.
She may have, that is the most likely diagnosis, especially if it was an adolescent female. The thing is, once your breast start developing this excess fibrous tissue, there's a possibility that more will develop. So she may have taken out one lump and more appeared. The thing is, once you have diagnosed the first lump, once she is adequately monitoring her breast, and these lumps are often they're often screened and they're often followed in time with ultrasounds. You don't need to take out all. What you need to do is adequately follow up and monitor these breasts because there is no hard and fast rule that she'll take up two and three and others won't appear. You took
Okay.
out the first one, it is not a cancerous lump. You monitor her, you go to the doctor, you get her clinical examinations done. Because remember, I made some points before. My actual last 2 points were breast screening and seek help early. Breast screening, in that if you are under 40 years, you do your breast exams monthly, and at least every 3 years, you should have a medical practitioner examine your breast. And if you are 40 or over, you do your breast exams monthly. Yearly, you have a medical practitioner examine your breast. And from 40 years, we start doing what is called the mammogram test, which is basically just x-rays of your breast. But the thing about the mammogram is that it first detects breast cancer, because you may pick up changes on the mammogram that denote a breast cancer 1 to 2 years before you actually have a palpable lump. So,
Oh,
happen, know your family history, get to know your breasts, know the warning signs of breast cancer, adequate breast screening, your self breast examinations monthly, your clinical examinations with your medical practitioner, and your mammogram once you're over 40. Ladies, go out and get it done. And seek help early, because early detection remains our primary defense in preventing breast cancer. With early detection, adequate treatment, and adequate support, we can overcome this disease, and we can start to decrease the mortality rate for breast cancer in today's vulnerable.
all right. Okay. So thank you so much, Dr. Jordan. Thank you, Dr. Miller. I know that we can have a part two, and we'll see how best we can work that out. All right. I know you ladies have to run off right now. I'm so sorry we couldn't spend at least an extra 10 minutes with you. But thank you so much for taking the time out to discuss the physical and emotional side of breast cancer this morning during the month of breast cancer awareness. All right.
So, Crystal,
Mm-hmm.
just to interject here, that the Scotch Cancer Support Foundation, for persons who may be battling cancer, that support is available. We offer psychological, financial support to persons in need. That you can contact us at 4562948. Usually we meet the third Tuesday of every month, but because of COVID right now, we have ceased our face-to-face meetings, but you can contact anyone from the committee for 4562948.
All right. If you guys are listening, all right. If you need some support, then there's an avenue to get some support. All right. You mentioned financial and psychological support, right?
Yes.
Oh, okay. All right. Thank you so much. Any final words before we wrap it up?
Well, I think Dr. Jordan said it well. Early detection saves lives. That's what we focus on right now. And we want persons to get involved in their own healthcare. It's your responsibility.
All right. So thank you very much. Have a wonderful day, ladies.
Thanks
Thank
for
you.
having us.
All right. Not a problem.